Keep Your Faith Corporation is a grassroots nonprofit with 4 program areas. They're all based in wellness and public health. So we have our behavioral health program. It's a licensed behavioral health center that really focuses on serving Appalachians in diverse and rural communities or marginalized. And then we have our workforce development program. And then we have what we call our food systems and access work and our outreach program. We have hundreds of clients so we have around 10 clinicians and they have full caseloads. And then which is around, I say 15 and up. And then we have, as far as the grocery store is concerned, it serves pretty much the local West Side area or Greater Charleston area. We do have a lot of people who come in to really support the initiatives of the store, but people who are reliant on the store, I would say the folks that are in walking distance that live on the West Side. So you can consider that entire community. So one of our strongest resources are our partnerships. Most of our partners are other nonprofits who are funded through federal funds. So our other executive directors that we work with, coalitions that we sit on who support the work, they're stopped right now. State employees aren't allowed to sit on any of the equitable health teams. We have coalitions that work on our equitable and accessible healthcare initiatives. Those are no longer allowed at the moment with all of the uncertainty, and so those coalitions are right now are at a pause. I just got an email yesterday from West Virginia Health Equity Action Team, which is West Virginia HEAT for short. We're not able to meet during daytime hours anymore, and so the initiatives that we were working on just around accessible healthcare and getting resources into practices like this, those conversations cannot happen during the day right now. So those coalitions and partnership, the people we work with, like Food and Farm Coalition, for example, are just uncertain as to whether or not they're going to be able to do federal drawdowns. We also had some outreach events. We had some federal funders and supporters coming in to talk to us about some of the upcoming grant cycles that would continue some of this food access work and healthcare access, which is our main 2 initiatives that are not able to come right now because the funds are frozen, and so travel is frozen. All operations have sort of stopped until we have some more certain direction. I think that one of the other major issues for us is the concern around Medicaid and what those limitations look like moving forward. I had mentioned before that the Medicaid portal shut down last week. We haven't seen any reimbursement since then. We're still sending out billing as regular, normal operations, but we're not sure if it's going to come back the same way or if any limitations are going to be in place that affect eligibility, affect the Medicaid fee schedule moving forward. And the majority of the population that we serve are covered by Medicaid. And so we're just really concerned about practitioners being able to sustain themselves, but also the main thing is interrupting continuity of care, that we won't be able to get care to the people who are the most in need. One of the big initiatives that we have, because West Virginia has such a disparity around providers as a whole, and I'm talking about around the healthcare continuum, our game is behavioral health. So a part of the workforce development that we're into is we are leading an initiative that is a behavioral health workforce pipeline. So we do a lot of training initiatives in-house. Supervision is taken care of so that we can take clinicians from internship to independent licensure where they're able to diagnose and treat. That will not be able to continue without the funding that is focused on equitable and accessible health care. And so right now it's uncertain as to whether that funding is going to be guaranteed. Because we have such a disparity, we also have very low workforce numbers. We run programs that are around what we call the recovery to workforce continuum. West Virginia is in the throes of healing and trying to transition from being, leading the opioid epidemic. We don't want to lead the opioid epidemic. And so because of that, our workforce numbers have been impacted. In order to support the people who are moving along that recovery to workforce continuum, we need our behavioral health practitioners. We also live in a high trauma area because of things like the opioid epidemic. So we have chosen to be a part of a network to serve first responders. So we have people who come in here from all sectors, including first response, and we are able to provide trauma-focused care to those workforce sectors. Without this funding, it would interrupt care for everyone, from the people that are consumers who are moving along the recovery to workforce continuum, to the first responders who have been the first point of contact to get those either themselves or those folks into care. And so for us, those initiatives are extremely important to the health and wellness of West Virginia at state level as a whole. So it's not really just about the immediate need, but also the long-term impact this is going to have on the public health of the state. I think that there's also an uncertainty from the supervision level when I'm overseeing clinicians. So we are trained to ethically accommodate the considerations of social and cultural norms. So I mentioned we serve Appalachians. West Virginia is the only state covered completely by this region. We're really proud of that. And we also have a focus on underserved and marginalized communities. And so there are a lot of disparities and treatment concerns that come with serving special populations. With the guidance that's coming down around staying away from equity-focused work, that causes a conflict with the way that we are trained around the way we're bound to ethics versus federal guidance and compliance with funding. And so right now we're really at a standstill. We're always going to lean towards ethics when it comes to treatment and care, but how do we continue to have our work supported, and what resources are we going to have to do that if the guidance is that we're not able to really focus on that equitable lens anymore.